This is the final part of day 15 in the trial against Lindsay Clancy. Yeah, I know I'm a few days behind, but the fact is that between another trial and work, I am swamped just trying to catch up. On day 15, Dr. Ziesel testified, the psychologist that was provided by Reddington after all of this transpired. On February 3rd, he receives a call late in the evening about Lindsay, that she was injured, she was hospitalized, and needed to be evaluated. He arrives February 4th to the hospital and they don't allow him in. So he has to have counsel intervene. Finally, that afternoon, he can see her. She is shackled to the bed. She has tubes, wires, and finally, after she's extubated, he can ask her a few questions because he needed to evaluate where she was at that time. She shared that she knew who she was, but she didn't know where she was or what day it was. After time passes, she asked about Patrick and seemed to be very concerned because she hadn't spoken to him. He said that out of compassion, he allowed him to call him. He didn't answer the first time. 2 days later, she calls him again. That is when she tells him that she heard voices telling her to take the lives of her children as well as herself. Dr. Ziesel makes it clear that in no moment did he ever insinuate those things to her. He'll coach her like the prosecution has made it seem. He has seen her more than 45 times since this has transpired, and even after he submitted his report in June, he's continued seeing her. He evaluated all of the medical reports, not only from her hospitalizations, but her family history, her school history, everything. He talks about between the month of September and January, she was dealing with a lot of postpartum symptoms that continued to escalate. Anxiety, insomnia, emotional flattening, numbness, inability to bathe, get out of bed, inability to even feel love or happiness. She saw multiple providers, was prescribed Zoloft, Trazodone, eventually Seroquel. And he says, look, she reacted poorly to Zoloft, especially after they increased the dose to 50 milligrams where her insomnia worsened. We know that after taking Zoloft, she was up for 48 hours. He describes her escalating desperation, the fact that she called suicide hotlines twice, turned away. She sought help that woman and infants in Rhode Island. She was told she wasn't a good fit because she was overly medicated. Continued to reach out for help as her symptoms intensified. She went to a psychiatric unit on a voluntary commitment because she feared she might hurt herself. Whose postpartum mental state was deteriorating. Medications made it worse. She sought help but was unable to stabilize. Now, when the prosecution cross-examines him, they try to make it look like, look, he is best friends with Reddington. He shares, I've known him for 20 years. I've worked with him in many cases. He decided to continue evaluating her because of the fact that the mental health of any patient is dynamic. And he was assessing her competency and risk over time. He sticks by his conclusions that her deteriorating postpartum condition, her repeated attempts to seek help were there. She did not get the help that she needed.